Hi, Kevin Henry, the Group Editorial Director for Advanced Stars Dental Division and Modern Hygienist, and I'm on a Google Hangout today with America's Dental Hygienist, Anastasia Turchetta. Hey, Anastasia, what is going on?
Hey Kevin, working a full day of clinical hygiene and just, fighting the battle like a superhero. How about you?
Well, that's every dental hygienist as far as I'm concerned, so nicely done there. Well, let's talk a little bit about the dental hygienist today. And here in Colorado, it's possible for dental hygienists to kind of hang up their own shingle and to have a place that patients can go without actually having to go to the dentist. But a lot of other states, it's obviously not the case. So if you're practicing in a state where you're working in a dental practice in the typical model, what are some ways that you feel hygienists can be more business savvy and more really involved in the dental practice's success?
That's a great question, Kevin. There's 6 ways that I believe hygienists really, if you're looking at it from a business, that we can forge forward in using basically our skills and what we're trained for. You've got to put the business hat on. That being said, number one, I would say, what do you bring to the table? So write down, so let's just pretend you're looking at a dental office or you're working in a dental office and you think, well, you know what, I'd like to have this, or I'd like to do this, or I read about that. What do you bring to the table? And I think you should write that down and have a strategy and come at it from all aspects. Okay, what would you need to make that happen? What do you know about it? Is there more that you could know about it? So when you propose that, it is a proposal to the doctor, you have everything answered, whether it be instruments, extra time on the schedule, technology. The point is you research that enough to come up with a business strategy and plan that will help the patients. I think that's first. Number two, I think if you would invest, dental hygienists invest in their own CE. Always continue to nurture your knowledge and your passion for what we do. And that's across the board in everything. It should not just rely on the dentist to say, oh, wow, the ADA is happening. I hope they take me. I do. It's not. If you want to take ownership within that dental practice, then you should be taking marketing courses. You should take social media, because a lot of these practices are doing it themselves. Or what about your clinical? What haven't you learned about that you could learn about? And that helps you also bring that to the table. Number three, I would say, and this is really strictly business, know your daily goals. You should come up with a daily production that you have that you can meet, and then revisit that. Did you meet? What did you treatment plan? Because if you're going to take ownership, this is part of the business. Know your numbers. Number four, write everything down. I know that sounds so simple. You and I both know that. I don't care if it's on a Google Hangout. It doesn't really matter to me. But it's really important to have these things in writing that both you and the doctor sign. And then obviously the next one is to visit that monthly. You're a business. So every single month, not quarterly, not once a year for the evaluation. This is a business. Because sometimes things get dropped. You get busy. And I understand that, but if you're looking at it from a business, you should really sit down with the doctor. Of course, prior to that, come up with your email, and then maybe re-sign that document. We revisited. This is where we're at as of October 21st. This is where we're at, and then finally, you really need to know your limitations. So not to be too assertive, but also know too the doctor's vision may not be your vision, and that I think is where a good business strategy is, because you've got to know where can you go with what you've been taught ethically, and where can't you go, and do you want to stay there? Those are 6 key things I believe that dental hygienists can show their doctors that they have ownership in the practice and they're invested. They're not just there for the money.
Which obviously helps the dentist a lot, knowing that if you're invested in the practice, that's a great thing. Do you generalization here? Do you find most hygienists are taking these steps, or is it mostly they're just clocking in and clocking out and being done for the day?
I find mostly they want to take the steps. You're going to have there's a few, of course. You're going to have some that they're there, who knows what's going on in their life. But I think the majority that I've worked with, they would love to do something more, but yet the assertiveness isn't there, or maybe the discussion hasn't happened or maybe the limitations were set before they could even discover what they were. So to answer your question, I would say the passion and the drive is absolutely there. It's just taking that intention and making it into an action to get the results.
Good insights, good advice, good as always, my friend. I really appreciate your time, Anastasia. Thanks so much.
Thank you for having me, Kevin.